Be still, my soul, the Lord is on thy side. With patience bear.
Modern buildings and asphalt now obscure the important history of West Lebanon, New Hampshire. As a young boy, the prophet Joseph Smith displayed great courage in a home that once stood here.
After a series of financial setbacks, Joseph Sr. and Lucy Mack Smith moved their family from Vermont across the Connecticut River into New Hampshire, where they resided in what was known then as Lebanon, today known as West Lebanon. They were there from 1811 until 1813. And Lucy said, in Lebanon we settled down and began to congratulate ourselves upon our prosperity, and also to renew our exertions to obtain a greater abundance of this world's goods. Then she continued, we met with success on every hand, but the scene soon changed. In 1813, the typhus fever came into Lebanon and raged there horribly. All of the Smith children were soon afflicted with this dreaded disease, which threatened to take their lives. When nearly recovered from the typhus fever, Joseph, at the time he was a mere 7 years old, one day suddenly screams out with this severe pain in his shoulder. So they called a doctor to the Smith home there in Lebanon, and upon examining this lad, they discovered there was a large fever sore.
Now, Joseph had been sick with typhoid fever, and debilitated, and he developed an abscess under his left armpit, axillary abscess. The person who drained that, according to Lucy Mack, he drained a quart of pus out of this abscess in this 7-year-old boy.
They lanced that fever sore, and the pain at that time shot like lightning down his side into the marrow of his leg bone on the same side. Then the leg began to swell and cause this intense pain for about 3 weeks before the doctor returned, and this time he makes an 8-inch incision between the knee and the ankle, and it relieved the pain somewhat. Lucy, the mother, then carried her young son Joseph in her arms throughout the day. He's unable to walk or get around, and she's also attempting to calm and to comfort him, until then eventually she too becomes so ill from exhaustion she can't do it anymore. Then she records that at that time Hiram, who was then 13 years old, this are her words, was always remarkable for his tenderness and sympathy, desired that he might take my place. We laid Joseph upon a low bed, and Hiram sat beside him, almost incessantly, day and night, grasping the most painful part of the affected leg between his hands, and by pressing it closely, enabled the little sufferer the better to bear the pain which otherwise seemed almost ready to take his life.
Another surgeon made an incision from knee to ankle through the swelling, and the pain was relieved, but of course the disease was not treated. And the second time he did it, he felt the bone was involved, so they called in Smith and Perkins and a crew of medical students from Dartmouth.
When the fever settled in Joseph's leg, doctors feared they might have to amputate, but Lucy persuaded them to try removing only the infected portion of the bone.
They'd had to restrain him to do the surgery. Normally they would tie him down 4-quadrant restraint, and he didn't like that, but I think his father sat beside him, and then these medical students who were there, I'm sure, held him down, because you can't do this without holding him down.
Dr. Nathan Smith performed the delicate surgery on the young Joseph. Pieces of bone were broken loose with the medical tools of the day, trephines or hand drills and bone-grasping forceps.
He had this procedure which was not done anywhere that I could find, anywhere in America or Europe. he was the only one doing it. Certainly back in 1797, he was the only one doing this. Nathan Smith was really good. He didn't need x-rays. No one would attempt that operation without a million x-rays. But he would take his finger and feel along the bone, and he could feel where it's diseased. And then he would go after that part. He used to give his notes, and the students would take it down verbatim. They put down every word he said. And the one student mentioned that as he gave this talk on how to deal with osteo, he said, it occurred to me that I might be able to save some of these legs by going directly to the bone. Just occurred to him, 1797. Didn't occur to anybody else. I think you need to know a little bit about the disease. He had osteomyelitis, which was common in New England among young people in those days. Osteomyelitis forms a death of the bone of the outside. You have the old bone in the center of this new shell. He would make an incision, feel along the bone where the abscess was. They would drain the pus out. So they would drill in the outer bone, take a window of that out, and then go into and pull out the dead part with pincers. But this would be the scalpel, and then he would use his finger to expose the bone. And then to get into the bone, he'd have to make little drill holes. And then he would take a hay saw and connect the burr holes, and then with the pincers remove that. Then he would go in with a pair of these bone crushing things and break up the piece that's contained within, and then reach in and pull it out. And he describes that, and so does his mother. He said, once you remove all the bone, you don't touch that wound with anything. You don't probe it, you don't put anything in it. You just let nature heal it, which it would do eventually.
When Lucy indicated that she was had been sent away from the home, Joseph didn't want his mother to see him, but he screams out in pain so loudly that she comes rushing into the home and into the room, bursts through the door, and sees this scene of this little boy, laying in bed, his leg exposed, blood everywhere, and it's just more than she can take. Joseph, interestingly to me, this little boy is concerned his mother doesn't see him this way, wants to send her out of the room again, and just wants his dad to hold him. And so we have an amazing means through these stories to see the life of a young boy who has some determination, but also has great trust in his father, has great consideration for his mother, who he knows is already exhausted, and maybe we could say loves him to the point of going beyond what even we can imagine today of a mother that would give her life for her child, and him being sensitive to her in that situation.
Dr. Nathan Smith's saddlebags are on display at Dartmouth Medical Admissions Office. Additional saddlebags and a medicine chest belonging to Dr. Smith, as well as other medical artifacts, are exhibited here at Dartmouth Hitchcock Medical Center. The hand of the Lord is evident in the Smiths' move here to Lebanon, because at that time, Dr. Nathan Smith was the only surgeon known to perform such an operation.